Now, Doctor, the deaths are not abating, a fact which shows that we are not succeeding in keeping the virus far from the vulnerable in society. And why is this? And isn't it possible to record zero deaths?
Oh, well, thank you for having me once again. The rate of increase or the spike in the numbers of deaths over the past few days is troubling when compared to the 2 months it took to get get deaths from index case to 58. There may be a number of possible reasons could account for this. Probably we're dealing with a more virulent strain of the virus. All that there is greater amount of spread to vulnerable people, and that's where the concern is. Do you know, the timelines for COVID-19 is taking over a year, and around August, from August to festive season last year, I mean, cases were low, transmission was low, but then it also meant that people might have let guards down, and during festive seasons, the festive season, there was a spike, which I believe we're still in. The spike probably, that letting our guards down probably would have resulted in a greater spread of the disease, and in absolute numbers, more vulnerable people coming in contact with the virus, and then more deaths. That's one aspect, and that's one perspective to it. The other being that, like I've already mentioned, we're probably dealing with a more virulent strain of the virus.
Dr. Sule, do you think that perhaps there is a good grasp on the messaging and especially keeping the most vulnerable population safe until the vaccines arrive? Do you think?
I actually think averagely most people know more than average of what needs to be known about COVID-19. People tend to know it's a virus, and people, I believe, tend to know that it's fatal if there is a background illness. So I believe people know that. But what I think is driving this greater spread that we're seeing is people have become apathetic, a bit fatigued. People have seen that the disease wasn't as fatal as projections expected it to be, or projections cast it out to be. So that again, because we're human beings, that again would probably have influenced going soft on prevention, and people just letting their guards down and not doing what we're supposed to do to prevent spread.
But looking at the recent coronavirus cases of below 700, the daily tally since last Friday, what can we say for sure is happening, briefly?
Yes, of course. Thankfully, there's been a decline from the spike we began to notice from last festive season. Cases numbers are going down. But from the latest release from the NCDC, the seroprevalence of antibodies studies they did, which showed that in a certain state in Nigeria, that is Lagos, which accounts for the majority of our cases, close to about a quarter of the people tested had antibodies for coronavirus. So that may give an inkling into the number of people who have had this virus. But I think our response is typical, because over 90% or around 95% of people who've had this virus would recover. So it's possible that people who have had the virus early on in 2020 and have developed antibodies have lost those antibodies and have come in contact with the virus again and now had those antibodies. So ultimately, the trends are coming down. It's showing that possibly there's a lot of positivity that's gone on in the society, and then people have lost antibodies. People have lost antibodies and have gained them and are not falling as sick and presenting to hospitals as it was during the festive period.
What a virus. Well, we'd like to thank you, Dr. Hassan Sule, public health physician. Thank you for joining us on the program.
Yep, thank you very much.